Hello, I'm Dr. James Bogash, expert in health and longevity and creator of Bogash Life and Balance. And today we're going to talk about the relationship between blood pressure and diabetes because it's a really strong relationship. And while I'm going to point out an article and how they're related, I think that I'm quite confident that these people have it completely wrong and backwards. The thing to understand is that almost every case of high blood pressure is actually prediabetes in hiding. I could bore you with the relationship between nitric oxide and asymmetrical dimethylarginine and elevated insulin levels, but I won't. Just rest assured that high blood pressure and prediabetes and diabetes are intricately connected. And that means that a lifestyle that is anti-diabetic will lower blood pressure in almost all cases. Sometimes you need to get quite specific, but most doctors, unfortunately, don't know the subtle details, how things like antiseptic mouthwash can actually raise your blood pressure. But only if you're eating avoiding it can only help if you're eating the right types of food, and if you're not on a certain medication that will affect that process. So most doctors don't understand the nuances of what goes into blood pressure control. So what does all this have to do with? Well, there was a review, a very large review, looking at a large number of patients over the course of years on whether or not certain blood pressure medications could lower the risk of diabetes. And what they found was that there was a relationship, that people who were on ACE inhibitors, so on average, every systolic blood pressure drop of 5 millimeters mercury led to an 11% lower risk of diabetes mellitus. So, that's not a huge change, but it certainly adds up. But here's specifically the ACE inhibitors. So think your prils, like your lisinopril, those had the 16%, those people who were taking them were at a 16% lower risk of developing diabetes over time. And the ARDs, angiotensin receptor, ARBs, blockers. And those also were 16%. Think of things like your valsartan, Sartans. Unfortunately, a lot of these drugs in the past couple of years have been recalled because of potentially cancerous compounds. So blood pressure may be lower, may not get diabetes, but you might get cancer. Also in this study, which is something we see again and again and again, and I still have patients who are given beta blockers, so your OLs, for their high blood pressure. And again, this beta blockers were shown to actually increase the risk of diabetes by 27%. We've seen this again and again and again. We've known this for at least a decade. So if you're on beta blockers like atenolol or propranolol, it may be time to go back and talk to your doctor. And unfortunately, if they aren't aware that beta blockers increase your risk of diabetes and stroke, then maybe it's time to find a new doctor because they haven't cracked the medical journal in at least a decade. Thiazide diuretics also increase risk of diabetes by 20%. So, but the bottom line is that these are probably not, it's not that taking blood pressure medications and lowering your blood pressure had to do with lowering risk of diabetes. These drugs probably had some other type of an effect that had a minimal effect on lowering, they lowered blood pressure, but some other effect also led to the low risk of diabetes. We see that in things like statins, which have a very small anti-inflammatory effect. And so if they protect against other things, it might just be because they have a small anti-inflammatory effect. But this is not, taking blood pressure is not your way to lower diabetes. You really need to address it with lifestyle and make sure that you understand everything that contributes to high blood pressure as it relates to your lifestyle. Luckily enough, this is something that I teach classes on, so I understand this concept really well. I've got a couple ebooks and quite a few articles on this same topic. Again, I'll post that in the description, but also I'll post a link to this large review in the description as well. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.